Welcome to the Bariatrics Center at Nebraska Medicine. This video is designed to provide information related to the services we provide that can benefit you. We offer both surgical and non-surgical options to assist with weight loss and help patients become healthier through intensive lifestyle changes. The Bariatrics Center was built in 2013 with our patients in mind. We know this process can be overwhelming, so we made sure that coming to our clinic is not. For your comfort and convenience, our clinic features parking stalls right in front of our doors and size-appropriate accommodations.
I need you to sign the consent to treat today. I'll read this to you, and when we're done, we just need you to sign this.
There is no cure for obesity. There are only tools to treat the disease. Our goal is to help patients find the best tools for their healthcare needs. The Bariatrics Center is accredited by the American Society for Metabolic and Bariatric Surgery Quality Improvement Program. This designation recognizes surgical programs with a demonstrated track record of favorable bariatric surgery outcomes. We are the only program in the greater Omaha area that has services available to people of all sizes. Whether your goal is to lose 20 pounds or 200, we can help. Long-term weight loss requires lifestyle changes related to behavior, nutrition, and physical activity. Behavior changes include working with a psychologist or medical nutrition therapist to set health-related goals. We help patients evaluate their relationships with food and generate healthy coping techniques. Development of healthy eating plans is also important. Our medical nutrition therapists will teach you nutritional analysis skills and help you develop strategies to exercise portion control. While developing strategies on what you consume is vital, it's also important to establish an exercise program for metabolic benefits. Our multidisciplinary team of physicians, supported by a group of highly trained specialists, will work with you to lose weight through a variety of surgical and non-surgical programs. For patients with a body mass index of 35 or more, we may be able to offer bariatric surgery as an option. We also offer non-surgical programs, including nutritional counseling, meal replacement plans, and prescription therapy used in conjunction with diet modification and physical activity. Bariatric surgery is a consideration for people who have a large amount of weight to lose. It's considered to be the most effective treatment of obesity for long-term weight loss. However, it is important to understand that surgery is a tool and not a cure for obesity. Patients must do their part by changing their eating habits, exercising, and committing to a lifelong follow-up plan with their surgeons to ensure long-term health and accountability. The number of Americans having weight loss surgery increases annually. Our bariatric surgeons have over 20 years of combined experience. We did our first weight loss surgery at Nebraska Medicine in the early 90s, so we have the experience you need. The most common procedures are the gastric sleeve and the Roux-en-Y gastric bypass. Nebraska Medicine performs most bariatric surgeries laparoscopically, which means the procedure is less invasive and requires a much smaller incision, resulting in faster recovery. We offer 6 different surgical procedures for weight loss: Roux-en-Y gastric bypass, sleeve gastrectomy, adjustable gastric band, biliopancreatic diversion with duodenal switch, modified duodenal switch, intragastric balloon. Next, we will feature some short procedural videos showing the different surgical options.
This educational video will explain the normal process of digestion, the Roux-en-Y gastric bypass procedure, and how weight loss will occur upon completion of the surgery. Currently, your stomach can hold about 40 ounces of food. Once in your stomach, the food combines with digestive juices containing acids and enzymes that help break it down into smaller particles. Once broken down, the small particles are slowly released into the first part of your small intestine, the duodenum, by a muscle called the pyloric valve. The pyloric valve is a ring of muscle between your stomach and your duodenum. Most of the nutrients from the broken down food are absorbed in the duodenum and the jejunum, which is the second part of the small intestine. The steps in the Roux-en-Y gastric bypass involve dividing your stomach into 2 sections to create a smaller stomach pouch, dividing your jejunum into 2 sections, creating a Y connection between both parts of your jejunum, and creating a connection between your stomach pouch and jejunum. Your surgeon starts by using an endoscopic stapler and divides your current stomach about 1 to 2 inches below the area where your esophagus connects to your stomach. The smaller upper section of the stomach that is connected to the esophagus is your new stomach, also known as the gastric pouch. This gastric pouch will hold about 2 ounces of food. Next, your surgeon divides and seals your jejunum into 2 sections. Your surgeon will take the shorter part of your jejunum and reconnect it to the longer part of your jejunum at a point further below the point of division. Next, the remaining part of your jejunum is pulled up and attached to your gastric pouch. Food will now go from your new stomach pouch directly into your jejunum. Prior to surgery, food went from your stomach into your duodenum. Your duodenum and a small part of your jejunum are now bypassed and will not come into contact with any food. Because food bypasses the duodenum and part of the jejunum, fewer calories are absorbed.
The average patient with the Roux-en-Y gastric bypass loses 60 to 70% of their excess weight in 1 to 1.5 years. Long-term weight gain is usually 10 to 15% of weight lost. With any type of weight loss, you will likely see the improvement of other health issues. For example, diabetes is often improved, if not completely resolved. Many patients are cured of sleep apnea and reflux, and the large majority of patients experience an improvement in blood pressure, cholesterol, and triglyceride levels. After surgery, a small number of patients may experience short-term complications such as abdominal infection, blood clot, leak, nausea, or vomiting. Long-term risks may include hernia, bowel obstruction, ulcer, vitamin deficiency, and malnutrition.
This educational video will explain the normal process of digestion, the sleeve gastrectomy procedure, and how weight loss will occur upon completion of the surgery. Currently, your stomach can hold about 40 ounces of food. Once in your stomach, the food combines with digestive juices containing acids and enzymes that help break it down into smaller particles. Once broken down, the small particles are slowly released into the first part of your small intestine, the duodenum, by a muscle called the pyloric valve. The pyloric valve is a ring of muscle between your stomach and your duodenum. Most of the nutrients from the broken down food are absorbed in the duodenum and the jejunum, which is the second part of the small intestine. There are 3 main steps in the sleeve gastrectomy. The first step is disconnecting the tissue between your stomach and your abdomen. The second step is dividing your stomach into 2 sections. The third step is removing the upper rounded left part of your stomach. In the first step, tissue between your stomach and your abdomen is disconnected. Your surgeon will separate the tissue that connects the left side of your stomach to your abdominal organs, such as the spleen and the colon. The second step is dividing your stomach into 2 sections. Your surgeon will divide your stomach using an endoscopic stapler. Your surgeon may also use traditional stitches or a combination of both staples and stitches to seal each section of your stomach. This seal is called the suture line. The third step in the sleeve gastrectomy is removing part of the stomach. Your surgeon will remove the left part of the stomach, which includes the fundus. The fundus is one of the areas of the stomach that produces the hormone that controls your appetite. The remaining portion of your stomach will be about the size and shape of a banana. Once you have healed from the surgery, weight loss will occur because of 2 reasons. First, your new stomach size will force you to decrease the amount of food you can comfortably eat. Secondly, the sleeve gastrectomy will cause your body to decrease or eliminate the release of a hormone that stimulates the appetite.
On average, sleeve gastrectomy patients lose at least 50% of excess weight within 1 to 1.5 years. Fewer than 1% of patients experience complications such as leak or blood clot. Long-term, patients may suffer from reflux, failure to lose weight, or experience weight regain.
This educational video will explain the normal process of digestion, the laparoscopic adjustable gastric band procedure, and how weight loss will occur upon completion of the surgery. Currently, your stomach can hold about 40 ounces of food. Once in your stomach, the food combines with digestive juices containing acids and enzymes that help break it down into smaller particles. Once broken down, the small particles are slowly released into the first part of your small intestine, the duodenum, by a muscle called the pyloric valve. The pyloric valve is a ring of muscle between your stomach and your duodenum. Most of the nutrients from the broken down food are absorbed in the duodenum and the jejunum, which is the second part of the small intestine. The steps in the laparoscopic adjustable gastric banding procedure, also referred to as LAGB, involve placing an inflatable band around the stomach, stitching both sides of the stomach around the band to secure the band in place, and inserting a port underneath the skin. Your surgeon will place the adjustable gastric band into the body through a cannula, which is a hollow tube inserted in your abdomen during surgery. Once inside the abdominal cavity, your surgeon will pass the band behind the back of the stomach near the top area where the esophagus connects to the stomach. This part of the stomach is known as the gastric pouch and has the capacity to hold 1 to 2 ounces of food. Your surgeon will then lock the band into position by threading one end of the tube through the hole on the other end of the band. Your surgeon will secure the band by stitching the part of the stomach that is directly below the band, called the fundus, to the part of the stomach just above the band. These permanent stitches prevent the band from slipping. After the band is secure around your stomach, the remaining part of the tube is pulled through a cannula, so the end of the tube is outside your abdominal cavity. Finally, the surgeon attaches a port to the tube and secures it to a layer of muscle on top of the abdomen but beneath the skin. After surgery, the port allows your surgeon to adjust the constriction of the lap band by injecting a liquid into the port, which travels to the band and inflates it. Weight loss occurs because after surgery, you will be very restricted in the quantity of food you can eat before feeling full.
Patients with the adjustable gastric banding procedure average 40 to 50% of excess weight lost within 3 years. This procedure has declined in popularity in recent years because patients may not lose as much weight as with other procedures. In the long term, the band may slip or erode into the stomach, which requires band removal or bariatric revision surgery. The biliopancreatic diversion with duodenal switch is an extreme version of the gastric bypass. It is only appropriate under certain circumstances. This procedure bypasses 80% of the small intestine, which makes it more malabsorptive. This procedure has higher risks at the time of surgery and higher long-term nutrition risks for the patient. The procedure does result in weight loss of approximately 80% of excess weight. However, some of the side effects are difficult for patients to live with, so the procedure is not done often. Recently, the modified duodenal switch was developed to give patients the benefits of the BPD procedure without the major side effects. The surgery is a combination of the sleeve gastrectomy with intestinal malabsorption. There's only one connection rather than the two in the BPD. In addition, not as much of the small intestine is bypassed, which reduces the side effects like frequent bowel movements and vitamin deficiencies. Since the procedure is new, we don't have long-term outcomes for it. The newest weight loss procedure developed is the intragastric balloon. It's available to patients with a BMI between 30 and 40. A balloon is inserted into the stomach to reduce the space available for food. The balloon can remain in place for a maximum of 6 months. In trials, patients lost approximately 30% of their excess weight. The major side effects are nausea, vomiting, and abdominal pain. In addition, insurance companies are not likely to pay for this procedure. While all surgical procedures discussed here will help you lose weight, they are not a cure for obesity. Your weight loss success depends on your desire and commitment to make changes in your behavior, improve your nutrition, and increase your physical activity. The Bariatrics Center also offers a variety of non-surgical options to help you lose weight. We have several medical nutrition therapists who work with patients to learn more about making good nutrition choices. We also have a bariatrician who will review your current prescriptions to identify any medications that might be contributing to weight gain. If you're watching what you eat and exercising regularly and your weight loss is stalled, a weight loss medication might be an option for you. This isn't a magic bullet. Prescription medications for weight loss are used as an addition to, not a replacement for, diet and exercise. Intensive behavioral therapy has proven to be an effective component in obesity management, and that's what we offer when working with our medical nutrition therapists. They will help you make lifestyle changes that will result in weight loss averaging 1 to 2 pounds per week. While losing weight, you'll adopt behavior changes that will help you keep the weight off. For patients who want a more structured, restrictive approach to weight loss, we offer the New Direction Meal Replacement Program. It is a medically monitored approach to weight loss utilizing great tasting, high protein and low carbohydrate meal replacements including shakes, soups, and bars. Our non-surgical weight loss options are available to patients with a BMI of 27 or more who are interested in using diet, exercise, and possibly medication to achieve a healthy weight. When considering what weight loss option is best for you, ask yourself these questions. How much weight do you want or need to lose? Are you interested in weight loss surgery? Are you interested in a meal replacement program? Are you interested in individualized instruction with a dietitian? What health problems would you like to see improve or resolve?
I'll let her know. Okay, and then we'll call back and check on you. Okay. Okay, thank you.
When you're ready to move forward with improving your weight and your overall health, we are here to help you. If you're interested in surgical weight loss, check with your insurance company to see if you have bariatric benefits for weight loss surgery and what the specific requirements are. For our non-surgical weight loss programs, check with your insurance company to see if you have coverage for medical weight loss. Once you've contacted your insurance company to determine coverage, please contact us at the Bariatrics Center at 402-559-9500 and we will guide you through the next steps to making an appointment and beginning your weight loss journey. We look forward to working with you to achieve your weight loss goals.